Hello, ladies and gentlemen. It's Jonathan Shafani, a certified body language master. And today we'll see Dr. Anthony Fauci speaking about coronavirus. We'll see his hidden emotions and his true thoughts about the matter. And we will begin with this interview. Please focus on his neck. Okay, we'll see some movement around the neck area. Let's begin with this interview.
The president again today repeated his endorsement of hydroxychloroquine, which the FDA said in June should not be used for.
Okay, did you see the swallowing? This is a sign of fear. Also, the pressed lips, a sign of controlled sadness. The eyes also are closing, which indicates contempt. So all these emotions are circulating inside his mind and his body.
COVID, because it does not have known effects, known benefits, and it does have known risks for cardiac effects. So, how damaging is that he retweeted the video and defended it again today?
Well, the only thing that I can do, Andrea, is do what I've done all.
Okay, did you see that? The only thing that I can do is, and he shook his head no, to do what he's been done for a while. So clearly that he can do more, but he chooses to not to do some things, maybe because he's afraid. Maybe, I say maybe. And I don't want to jump into conclusions, because here a lot of hidden information is clearly the case, because we will see a lot of contradictions in his speech throughout this video. So let's continue.
Along consistently is that you look at the scientific data and the evidence, and the scientific data, the cumulative data.
Okay, did you notice that he said you look at the scientific data? So he went from what I can do to you can look to the scientific data. Okay, he didn't continue with the I thing, with claiming responsibility or claiming authority of this this statement. So this is very important.
Data on trials, clinical trials that were valid, namely clinical trials that were randomized and controlled in the proper way. All of those trials.
Okay, when he said all of those trials, he shook his head no, which is an indication of he is contradicting his statement. And please focus on him now.
Show consistently that hydroxychloroquine is not effective.
Okay, so he said is not effective. So he's nodding yes. He's not saying is not effective. So this is his yes, and this is his no. He's saying is not effective. So he nodded yes. Also, this is a contradiction.
In the treatment of coronavirus disease or COVID-19.
So it might be a certain explanation. It might be that this drug can heal, can cure some of the people, okay, with certain dosage, with how to say it, that their cases are positively proven and not fake ones. So he might think that yes, this drug can be used for these cases, but not for everyone, not for every single person that is diagnosed with COVID-19.
My family received an email yesterday from a young friend of ours, a university graduate. She's now back home in her village in rural western Kenya, telling us if now there's a cure. Today in the newspapers in Kenya, warnings and columns to tell people don't believe that video. If this can be transmitted around the country and globally so rapidly, don't we have to do more to stop these dangerous conspiracies from misleading?
Okay, and now please notice his reaction, his first reaction.
People.
Yeah, you're absolutely correct.
Okay, first, did you notice the cracking voice? you're absolutely correct. And he shook his head no, and also he retreated a bit. So all these signs, this cluster of signs, is a clear indication that he is not telling the truth. And now I don't want to go into some of the conspiracy theories out there. It's not of my business. I'm just analyzing his own body language, and you have the option to think for yourself and to gather all these things and to get into uh, a logical explanation for all of these.
Andrew, and that's the reason why I'm very explicit.
Okay, he's saying I'm very explicit with his head shaking no.
And unambiguous.
Okay, did you see that? Unambiguous. So half yes, half no.
When we say we've got to follow the science.
Okay, we've got to follow, and then he hesitated, and then he said the science, so no, and he closed his eyes. So this is very, very, very interesting. Uh, of course, you can think for yourself. You can figure it out maybe. I won't jump into conclusions right now because this is not what I do in this video.
If a study that's a good study comes out and shows efficacy and safety for hydroxychloroquine or any other drug that we do, if you do it in the right way, you accept the scientific data. But right now, today, the cumulative scientific data that has been put together and done over a number of different studies has shown no efficacy.
Okay, so you can see the whole picture now. You got used to some of the things that body language specialists rely on. Facial micro expressions, head movement. Of course, we are not seeing his whole body now. This can be very interesting if we saw everything, but just from his face, also his facial micro expressions, these tiny muscle contractions are really indications of a hidden script that is saying things that can be contradicting what the person is saying. So thanks a lot for watching this video. I hope you enjoy it. If you have any questions about lie detection, about body language, you can contact me. Thanks a lot and God bless you.